Most people assume that death in old age is sudden, but the truth is that the body often sends silent warnings months, even a year before life reaches its final stages. Follow me, because these important signs are often overlooked until it is too late to act. Now, let's get started. One of the earliest and most obvious signs that someone may be entering their final years is unintentional weight loss. At first, it can seem hard to notice. A belt suddenly needs to be tightened, clothes seem to be looser than before, or a once vigorous appetite has quietly disappeared. You might assume it's just a natural part of aging, since people often eat less or lose a bit of weight as they get older. But the truth is this: losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and vital systems are slowing down. Natural aging does lead to some muscle loss, but when this process happens too quickly, it's a warning sign. The body may be struggling to digest food properly, or the person may no longer be able to process protein efficiently, resulting in a decrease in muscle mass. And this isn't just about feeling weaker. Less muscle means a higher risk of falls, slower recovery from illness, and a weakened immune system that makes them more vulnerable to infections. Another common reason for weight loss in older adults is a loss of appetite. Many seniors simply don't feel as hungry as they once did. Their sense of taste gradually diminishes, and meals that were once enjoyable may now seem bland or unappealing. As a result, they may start skipping meals or eating significantly less. This isn't just a matter of preference, it's a physiological change. The body senses that it's starting to shut down, and it no longer signals the brain to seek food as frequently. The result is less energy, less strength, and a gradual decline in overall health. Then there's the role of underlying medical conditions. Weight loss can be a symptom of a more serious issue, such as heart failure, cancer, or kidney disease. These conditions can develop silently, long before other major symptoms appear. Even mental health plays a major role. Depression, anxiety, or cognitive decline can lead to reduced eating, creating a downward spiral in which the body isn't getting enough fuel to sustain itself. So, what should you do if you notice your loved one losing weight? Instead of pushing them to eat large meals, focus on comfort. Offer small, nutritious, and easy-to-eat options. Things like warm soups, soft fruits, or yogurt can provide calories without overwhelming them. Staying hydrated is also crucial. Many older adults silently suffer from dehydration, which only worsens fatigue and weakness. Sipping on water, herbal tea, or electrolyte drinks can make a significant difference. Above all, listen to their body. If they seem tired, restless, or uninterested in food, focus on moments of comfort. Your presence, calmness, and understanding can mean far more than any plate of food. If you have experienced this with a loved one, let us know by commenting number 1 in the comment section below. Next is a very important sign that very few people know about. Let's explore. According to research published in the Journal of the American Geriatric Society, persistent fatigue is one of the most common warning signs in older adults as they approach the end of life. Unlike regular tiredness, this type of exhaustion does not improve with sleep or rest. It lingers, making everyday tasks feel overwhelming. But why does this happen? When the body prepares for its final stages, it begins to conserve energy. Organs start to slow down, the heart pumps blood less efficiently, and circulation weakens. Muscles no longer receive the same flow of oxygen as before, causing the body to feel drained and unstable. Tasks that were once simple, like getting dressed, preparing breakfast, or even having a conversation, start to feel overwhelming. It's not just physical. The body's metabolism also slows down. Energy that once fueled movement is now redirected to maintain essential functions such as breathing, heart rate, and cognitive processes. This is why some older adults may seem healthy one moment, but become completely exhausted the next. And sadly, for older adults, this stage can be incredibly discouraging. Many seniors who once took pride in their independence may now feel embarrassed or frustrated because they can no longer do what they once did. The father who once enjoyed fixing things around the house may now avoid his toolbox. The grandmother who loved cooking for her family may now struggle to stand long enough to prepare a simple meal. This frustration can lead to withdrawal, not because they no longer care, but simply because they no longer have the energy. And that's when a heartbreaking cycle begins. The less they try, the weaker they become. So what should you do if your loved one seems too tired? Instead of urging them to push harder, focus on patience and compassion. Here are some practical steps you can take. Allow them to rest when they need to. Don't pressure them to stay busy. Help them focus their limited energy on activities that bring them joy. This could be a gentle conversation over a cup of tea, listening to music, or spending time with family. Keep their environment tidy and quiet. Simple adjustments like placing essential items within easy reach can prevent exhaustion from small tasks. If they experience sudden drops in energy or seem fine one moment, but exhausted the next, recognize this as a sign that their body is shifting its focus to preservation. Ultimately, what matters most is not how much they can do, but how loved, understood, and supported they feel in the time they have left. Next, we're going to talk about another sign one you may not have thought of. And if you found this information helpful, please like this video, subscribe to our channel, and turn on notifications. Your support helps us continue creating content that informs, inspires, and brings comfort when it's needed most. Have you noticed your loved one forgetting familiar faces or repeatedly asking the same question? This isn't just forgetfulness. It's a sign that their brain is struggling to function properly. As we age, the brain, like every other organ, depends on oxygen and nutrients to function properly. But as circulation weakens and the amount of oxygen delivered to the brain decreases, cognitive function begins to decline. The person may become confused, have difficulty making decisions, or have difficulty recognizing people and places they have known for years. In some cases, they may even have brief periods of clarity followed by sudden bouts of confusion, almost as if their mind is fading. For example, your grandmother may suddenly forget how to turn on the stove, even though she has been cooking in the same kitchen for 30 years. Or your father, who used to keep track of every appointment, may start missing important dates and conversations. Another common sign is emotional withdrawal. They may sit quietly during family gatherings, stop answering phone calls, or lose interest in hobbies they once loved. It's not that they no longer care about their loved ones. It's that their brain no longer processes emotions and social interactions in the same way. Conversations become exhausting. Noisy environments feel overwhelming. And eventually, many seniors withdraw into their own world. These cognitive changes can also lead to shifts in mood or personality. Some individuals become more irritable, anxious, or frustrated, snapping at family members over minor issues. Others may seem unusually calm or distant, as though they've lost interest in the world around them. These changes are often the result of the brain adjusting to the body's decline. As cognitive functions slow down, emotions become harder to express, and the person may stop reacting to situations as they once did. So, what can you do when someone you love starts to drift away in this manner? First, understand that this is not something they can control. They cannot simply snap out of it, and pushing them to focus more or try harder to remember won't help. Instead of trying to force them back to reality, meet them where they are. If they seem confused, don't correct them harshly. Calmly reassure them. If they forget your name, Don't take it personally. Gently remind them. If they seem distant, don't push them to talk. Sometimes your quiet presence is comfort enough. Creating a familiar environment can also help. Playing music they once loved, surrounding them with familiar scents, or spending time in safe and comfortable spaces can help ease their anxiety and confusion. And if you're still watching and found this valuable, comment number 4 below to let me know you're here. Next, we'll discuss another subtle yet powerful warning sign that is often overlooked until it's too late. Stay tuned to learn more. As we grow older, our immune system naturally weakens. However, when an older person starts experiencing frequent infections or delayed healing, it may signal something more serious is happening. So, what exactly is happening inside the body? As organ function slows down, blood circulation weakens. Blood, which carries oxygen, nutrients, and immune cells, no longer reaches all parts of the body as effectively. Cuts and scratches that once healed in a few days may now take several weeks. Bruises linger. Pressure sores, especially in people who are less active, become more common. The immune system, once strong enough to fight off common illnesses, now responds more slowly. Infections that were once mild, such as pneumonia, urinary tract infections, or oral infections, now pose a greater risk. Even antibiotics may become less effective. Patients may require stronger medications, longer recovery times, or multiple treatments for infections that were previously considered minor. This happens because, with slower blood circulation and declining organ function, the body simply does not respond to treatment as efficiently. An even greater concern is that infections in the final years of life often don't present the way we expect. Instead of high fevers or obvious symptoms, older adults may just seem more tired than usual, more confused or disoriented, and less interested in eating. For instance, what may appear to be simple fatigue could actually be an early sign of pneumonia. Or sudden confusion might point to a urinary tract infection. These subtle symptoms are often the first indicators that an infection is quietly developing. According to the National Institute on Aging, older adults are at higher risk of developing atypical infection symptoms, making these subtle warning signs easy to overlook. This is why recognizing these early changes, even when they seem minor, is crucial to ensuring proper care. So, what can you do if your loved one frequently experiences infections or slow healing wounds? Instead of relying solely on medications, focus on small but meaningful steps that provide comfort and care. Hydration, keeping your loved one well hydrated, will boost their body's ability to flush out toxins and fight infections. Water, electrolyte drinks, or soothing herbal teas can make a significant difference. Hygiene, gently cleaning wounds, moisturizing dry skin, and ensuring fresh bed linens can prevent infections from worsening. Reducing physical stress help your loved one conserve energy. Avoid pushing them to stay active when their body feels too weak. Instead, encourage rest and create a calm, peaceful environment. Preventive care, pay attention to small changes. A scratch that won't heal, a lingering cough, or sudden confusion may be the first signs that your loved one needs medical attention. Most importantly, remember that comfort, peace, and mental well-being are just as important as medical treatment at this stage. Have you ever experienced this with a loved one? Share your story in the comments below. Your experience may provide comfort and guidance to others who are on a similar path. Next, we'll talk about one of the most worrying signs. Understanding this can help you prepare for what's ahead. In the weeks or months before death, many older adults will notice noticeable changes in their breathing. You may notice that their breathing becomes slower, almost shallow, as if each breath takes more effort than before. Sometimes they may pause between breaths, leaving you silently counting the seconds. wondering if they'll ever inhale again. For some, breathing may follow a special pattern called Cheney-Stokes respiration, in which deep, rapid breaths alternate with long, quiet pauses. This rhythm can be distressing to witness, but it's common in the final stages of life. You may also notice that they start breathing through their mouth more often, struggling to get enough air. Simply changing positions in bed, sitting up, or talking for too long can cause them to lose their breath. And then there's circulation, another silent but powerful warning sign. As the heart's pumping ability slows, the body begins to prioritize vital organs like the brain and heart, reducing blood flow to the hands, feet, and other extremities. This is why their warm hands are now cold. Their skin may turn pale, or in some cases bluish or patchy, especially around the fingers, toes, or lips. These changes aren't just physical. They signal that the body is quietly conserving energy. When breathing becomes difficult or circulation is poor, you should shift your focus from trying to fix the problem to making your loved one as comfortable as possible. Here's how you can help. Create a cool, quiet environment. Keeping the room slightly cooler can help ease breathing difficulties. Opening a window to let in fresh air or using a small fan can help ease breathing difficulties. Use a humidifier. Dry air can make breathing more difficult. A humidifier can help keep the airways moist and reduce discomfort. Give them small sips of water. Dehydration can make them more tired and make them breathe more laboredly. Giving them small sips of water or even ice cubes can soothe their throat and help them relax. Help them find a comfortable position. Many people with breathing problems find it easier to sleep with pillows or in a recliner. This can take pressure off the lungs, making breathing easier. Speak softly and reassure them. Hearing the calm voice of someone they love can reduce anxiety and bring comfort, even if they have difficulty responding verbally. In some cases, medication or oxygen therapy prescribed by a doctor can provide more comfort. But the main focus should be on peace, comfort, and emotional security. As you reach the end of this video, please take a moment to reflect on what we've discussed. We talked about 5 silent yet powerful warning signs that often appear in the 5 years leading up to the final stage of life for an elderly loved one. Significant weight loss. When the body struggles to absorb nutrients, making your loved one weaker and more vulnerable. Extreme fatigue and frailty, when energy feels depleted, even after rest, and when simple tasks become exhausting. Confusion and cognitive withdrawal, when moments of clarity seem to flicker and fade, and familiar faces or routines become harder to recognize. Frequent infections and slow healing, when the immune system weakens, causing minor illnesses to linger longer than they should. Major changes in breathing or circulation. When breathing slows down, hands become cold, and the body quietly begins conserving its remaining energy. These 5 signs are not random. They are the body's quiet messages. By recognizing these signs early, you may gain valuable time for meaningful conversations, additional care, and ensuring your loved one's final days are filled with warmth, comfort, and dignity. And if you're facing this right now, or if you're worried about a loved one's declining health, please remember this: you are not alone. Many families have walked this difficult path, and although it is never easy, understanding these signs can help you find peace amidst the uncertainty. By being present, by offering comfort and love, you are giving your loved one something far more powerful than medicine. You are giving them the gift of feeling safe, cherished, and never alone. If you found today's video interesting, don't hesitate to hit the like button and subscribe to my channel. Your support is very important to us. Be sure to check out the next video appearing on your screen. You're sure to love the content we bring. Please leave a comment about which country you'd like us to explore next. Thank you for watching, and see you in the latest video.